Hello everyone, you are watching SwadeshiVIP and I am Yash Saxena. In this video, we are going to talk about calf diphtheria. For those who don't know what calf diphtheria is, it is an infectious disease affecting the pharynx, larynx and oral cavity. Fusobacteriumnecrophorum is part of the normal flora of the mouth, intestine and genital tract of the herbivore and omnivores. Calf diphtheria comes in two different kinds. The most typical cases usually affect calves younger than 3 months and is an acute oral infection. The bacteria Fusobacteriumnecrophorum, which also causes liver abscesses and foul in the foot infections in older cattle, is responsible for both types. The second form, which typically affects the older calves, affects the larynx, which is the voice box. Respiratory problems in cattle include diphtheria, the infection or inflammation of vocal folds of the larynx at the back of the throat. Infection and swelling from inflammation restrict airways and breathing is difficult. Air must travel through the larynx into windpipe and lungs. Swelling may cause death from suffocation. Severe cases may lead to extensive infection that gets in the lungs, causing pneumonia or septicemia that may quickly kill the calf. So, what are the clinical signs from which you can figure out that your cattle is suffering from calf diphtheria? Oral form. Initially presenting sign, just be a swollen cheek. Calf may be otherwise bright and active with no temperature. Examination of the inside of mouth shows a foul smelling ulceration and swelling of the cheeks. Temperature may be normal at the start. If untreated, more signs develop. High temperature, coughing, loss of appetite and depression, difficulty breathing, chewing and swallowing, swollen pharyngeal region, deep ulcers on the tongue, palate and inside of cheeks, pneumonia. Next is laryngeal form. Coughing, moist and painful, high temperature, loss of appetite and depression, difficult breathing, chewing and swallowing, pneumonia are some of it. Now, let's talk about the treatment. Infection in the larynx is generally very responsive to oxytetracycline because this antibiotic has a good distribution throughout the body. We also have good luck with penicillin. Some people prefer to use newer, longer lasting drugs because they don't need to treat as often. A person's choice might come down to inability to catch the calf. It may take a long time to overcome the infection. Every breath can damage the already swollen voice box, which is why it takes a long time to heal. Blood supply to this area of the body is also limited, which makes getting enough antibiotics for the infection more difficult. This is why treatment may have to be continued for several weeks. Early prompt treatment is important as early treatment is much more effective. Separate the infected animals and isolate them. Antibiotics and painkillers are effective in most of the cases. The laryngeal form is much more resistant to treatment. Get veterinary advice for it. Treatment is important, but how one should prevent this disease? Fusobacteriumnecrophorum is a normal inhabitant of cattle intestine and the environment. Under the unhygienic conditions, infection may be spread on the feeding troughs and dirty milk buckets. Some of the contributory factors for the occurrence of this disease include aberrations in the oral mucosa, such as those from erupting molar teeth, poor nutrition and the presence of other disease present in the younger calves. If animals are closely confined, the spread of this infectious disease can be prevented by thoroughly cleaning and disinfecting of all calf feeders. Young calves may be examined daily to identify early stages of the disease. So, this was all about the topic. For more videos on cattle health and dairy products, subscribe to our channel SwadeshiVIP. This is Yash Saxena signing off. Thank you.